My name is Gerardo Estrada, and I'm here to nominate Dr. Effendi for the Negro Foundation Patient Choice Award. What happened was I was doing a job in the Woodlands, Texas. Luckily enough, I was working with a supervisor of another company. He joined me out that day because if he wasn't there, it would have been very good chance I wouldn't be here. I believe I was complaining that I wasn't feeling well. I ended up calling my dad, hey, I don't feel too good. Hey, maybe I should go to the hospital or something. And he told me, talk to Jimmy, tell him to take you to the hospital. And when I got there and they saw, I believe they performed a scan on my head. I'm not too sure exactly what happened, but they saw my head filling up with blood. And that's how I landed into Dr. Effendi's care. From what I can remember, I had at least 4 major procedures. I had when they removed the skull to alleviate the pressure due to the AVM rupture. The second one was when they removed the AVM completely from my brain. The third one is when they placed the skull back. And then the fourth one, they saw my head filling up with cerebrospinal fluid and they rushed me directly to the emergency room to perform emergency surgery to install a VP shunt. The recovery process was long and challenging. If anything, it was probably the hardest thing I ever had to do in my entire life so far. The fact when I got discharged from the hospital, I wasn't walking. I had to badly learn how to walk again. Now, as soon as I left, that was the number one goal I had. I am going to walk. Mainly also due to the stroke I suffered, trying to recover the control of my left portion of my body. Since I had the stroke I suffered was on the right side of my brain, it affected the left side of my body. So getting control of my left hand, my left leg is still needs some more work, but the left hand is almost there. But the process is not done. I still have a long journey ahead of me. I guess you can see, wow, what I feel like I would be the perfect candidate to nominate Dr. Effendi because my gratitude towards him is, like I said, through the roof. I guess you can say it was something about his aura. And just looking at him, just his calm demeanor, his smile on his face, it just felt confidence oozing out of him. Like a sense of, I guess you can say sense of safety. Just from the way he carried himself, and I just felt like he's the one that's going to perform the surgery. He was very upfront with my family. He told them, hey, this is a situation. Like you said, being honest with my family, I can't guarantee you whether or not whatever's going to happen, but he's very sick. We're doing my hardest, to have him survive.
So we can't really predict if it's gonna improve or...
What we do is we remove about half the skull to help relieve the pressure. We kind of open the box, the brain can kind of swell out. So I removed half the skull, and he was very, 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 very swollen. And I closed the skin, the skull's gone right now, and we're gonna kind of monitor him in the ICU and get a lot of strong medicines to kind of decrease the pressure in the brain over the next day or two. He's young, so we're doing everything we can, right? We went emergent like right away. I mean, he got up here and he went to the operating room within 1 minute. And so we're doing everything we can to try to save him, but we have to kind of see how much this brain swelling goes over the next day or two.
So I'm thankful he was very upfront with my family. They would always express gratitude for Dr. Effendi. I would say his quality of care, if anything, I'm living proof of his quality of care. The fact that I'm sitting here speaking to all of y'all, I'm living proof that, his hard work goes a long way in this world.